Hello everyone, welcome back to my YouTube channel, The Exploring Medico. Now, we are going to start today General Anatomy Skeletal System Bones Section 2, which is the last section of this unit. Today's skeletal system will be completed. This section we have left incomplete in the earlier video, which is going to complete in this part. So this will be the last part of the skeletal system. Then we are going to start on another chapter. In case of any doubt, you can use the comment section. And we will be providing the same orthonic content. So please subscribe the channel. Do share the video with your friends, with the medical, paramedical students. In case you feel there is any kind of adjustment or you need any kind of changes, then you can ask us in the comment section. In any subject, whoever is the medico in charge for the specific topic or for the specific chapter, that medico will surely help you to compete out your doubts to make your concepts more clear. So please subscribe our channel. It is the content which is given in the free, so make a appropriate use of it. Okay, so let's start now. Blood supply of bones. Now, blood supply of a long bone. First we'll discuss. Now, the long bone is supplied by the four sets of arteries: nutrient artery, periosteal artery, metaphyseal artery, epiphyseal artery. This we have discussed in the earlier video. Now we'll discuss in detail. Now, first one, nutrient artery. It enters the middle of the shaft through a nutrient foramen, runs in the obliquely through cortex, and divides into ascending and descending branches in the medullary cavity or marrow cavity. Now, what about the nutrient? It enters in the middle of the shaft. You can see here from the nutrient foramen, this one, and now obliquely through the cortex. This portion, black one, this is known as cortex. And each branch then subdivides into a number of small parallel vessels which enter metaphysis and form a hairpin lobes. Now you can see that nutrient artery is divided into the various parts which forms the metaphysis. In the metaphysis there is hairpin lobes where the bacteria or emboli lodge. We have seen in the growing part of a long bone, hairpin lobes. And these lobes anastomosis with epiphyseal, metaphyseal, juxta and periosteal artery. So from there the loop with everyone. So from the center the artery start and it further you can see divide in the like these various parts. Okay. Now next, periosteal arteries. They are numerous and rami beneath the periosteum. They enter the bone through Volkmann's canal to supply the outer 1/3 of cortex. 1/3 part of cortex, that is this much, is the given by periosteal arteries, which enters through Volkmann's canal. Volkmann's canal is which has lacunae. We have seen like this. This is the structure of Volkmann, which has lacunae. Clear? And the periosteal vessels are especially numerous beneath the muscular and ligamentous attachments. So, muscular and ligamental attachment in the periosteal arteries. Now, metaphyseal or juxtaepiphyseal artery, they are derived from neighboring arteries, that is the joining arteries, and enter the metaphysis directly along the attachment of joint capsule. Where there is joint, from there metaphyseal artery comes, because we have already discussed that metaphysis is the having nerve innervation, and in the long bone it serves as the major part. From there, this is the metaphyseal arteries. It is on the both the end, because this is epiphyseal, this is diepiphyseal, this is metaphysis of the part of the bone. Now epiphyseal arteries. They are derived from arterial anastomosis. Now anastomosis means where 2 or 3 arteries join, where they form a junction, where they are there, where the arteries are there. That is arterial anastomosis. That is around, for example, circulus vasculosus. Circulus vasculosus. It is circumferential formation of arteries or veins. Circum means that is circumferential formation of arteries, that is like this, where the arteries are formed, and they enter the epiphyse either directly or piercing after the epiphyseal cartilage. So either they pierce the cartilage or they directly enter it. Getting it? This is epiphyseal artery. So sometimes they pierce and sometimes they enter directly. So this was all about a long bone. Now 2-3 points to note. Oblique direction of nutrient foramen in shaft is opposite to the growing end of long bone. So the nutrient foramen and shaft, nutrient foramen in the shaft and growing end of long bone, both are opposite to each other. Before entering the nutrient foramen, the nutrient artery is tortuous. Tortuous means vigorous, which has so many divisions, which is lengthy, and that is not affected during the movement of bone. So it will be like this, which has so many divisions. And the nutrient artery of tibia is the largest nutrient artery of the body, do remember. Okay. Now blood supply of short long bones, to an extent it is similar to that of long bone, except there are two exceptions which you have to remember. The nutrient artery, that is this one, and the first one which you have seen, enters the middle of the shafts and immediately divides to form a plexus. In the short long bones or long short bones, the nutrient artery forms plexus, where so many nerves and combine and form one major part, like brachial plexus, venous plexus. This you will learn in the upper limb. The perosteal vessels supply the major part of bone in adult and replace the nutrient vessels. So perosteal vessels replace the nutrient vessels, these two. Now blood supply of a vertebra. It is divided into 3 sets of vessels. One or more large but short vessel enters the body from its posterior aspect through a basivertebral foramen. Posterior means the lower aspect, and it enters the basivertebral foramen. Basivertebral foramen is also known as BVF. BVF is what? Opening of a posterior wall of vertebral body. In the spinal cord it is present, from where the posterior portion, we have seen a posterior aspect, from where they have the openings in the vertebral body, and it forms various basivertebral canals, neurovascular bundle courses, etc. A set of small vessels pierce the anterolateral surface of the body. Do remember, small vessels get pierced in the vertebrae, that is of the spinal, but how? They enter in the anterolateral. Antero means the superior and lateral is this side. Anterolateral aspect. This is the way the artery gets pierced, small vessels. A set of long vessels pierce the root of transverse process and supply the vertebral arc, transverse and spinous process. Various processes of the bone are supplied by long vessels in the vertebrae. Now blood supply of rib, it is supplied by 2 sets of vessels. First is the nutrient artery, which enters just behind the tubercle that forms in the bones, like glenoid tubercle, which we have seen, labrum, and the perosteal arteries. Now again note, the veins are numerous in calcaneous bones. For example, in the vertebrae they join to form a basilar vertebral vein. In the compact vein, they accompany the arteries in the Volkmann canals. This is just a note to remember that calcaneous bones vertebrae, one is basivertebral vein and one is Volkmann canal. Volkmann canal is associated with the compact bone. Basivertebral vein is associated with the cancellous bone. There are no lymphatics in the bone. However, some lymph vessels do accompany the perosteal blood vessels. There is the exception that some of the lymph vessels are present in the perosteal blood vessels, that is the perosteal arteries. Now applied anatomy, remember osteomyelitis. In a typical long bone, infections occurs on the metaphyseal region. Why infection occur in the metaphyseal region? We have seen na pin-like structure, hairpin, where the bacteria gets lodged, and that is the highest site and the highest risk site in the long bone. Firstly, because they are richly supplied with the blood, and secondly, because the blood supply metaphysis is through end arteries forming a hairpin bands. Therefore, the bacterial emboli easily trapped in these hairpin bands are leading to infraction, that is necrosis of bone, resulting in a clinical condition called osteomyelitis. ellipse. One is the hairpin bends and another is the rich supply of blood, and thus they lead to infection, that is tissue death. Remember, okay? In short long bones, the infection begins in the middle of the shaft because the nutrient artery enters the middle of the shaft and immediately divides into plexus. This we have seen earlier. Na? In the long short bone, the highest risk part is the nutrient artery because they form the plexus. We have seen just before a few minutes here. See. So in the long short bone, that is the highest risk. And the blood supply of a bone is so rich that passing of a metal pin cannot interrupt blood supply sufficiently to kill a bone. That much high blood supply is there. Now factors affecting growth of bone. First is nutritional factors. First is vitamin A. Coordinates the activity of osteoblast and osteoclast, that is cells of the bone. One is bone forming cells and one is bone destruction cells. The deficiency of vitamin A slows down the activity of osteoclast, that is bone destroying cells. Consequently, the size of spinal and cranial foramina is reduced because the destruction is less. So it adversely affects the size of bone. With eventual compression of nerve roots, on the other hand, the high concentration of vitamin A causes rarefaction and resorption of bone. Resorption is, so if there is less, it continues, and the rarefaction of the bone means what? Thinning of bone. Getting it? So if high content is there, then also it will do. Here to losing of bone, that bone is loosed like muscle waste, bone waste. Now vitamin C is essential for synthesis of organic intracellular matrix, that is collagen fibers and ground substance by osteoblasts, that is cells that form bone forming cells. The deficiency of vitamin A leads to defective development of growing heads of bone. If there is deficiency of vitamin A, it leads to defective development of growing of bone. It leads to rupture of capillaries, that is the destruction of the capillaries, producing a painful subperiosteal hematoma. It is a condition in which the potential space, we have discussed earlier video, potential space between periosteum and vessels or bones, where there is collection of blood between these places. It is subperiosteal hematoma. Between the two, where here somewhere blood will be collected. Getting? Now, vitamin D is essential for the absorption of calcium phosphate from intestine. Deficiency of vitamin D leads to defective mineralization or calcification of osteoid tissue, and as a result children suffer from rickets, that is characterized by bowing of leg, nobimetaphyseal region. Affected region is this. Remember, okay, affected region. Nobimetaphyseal. And adults suffer from osteomalacia, that is softening of the bones. So there will be rapid fractures. Now another is hormonal factors. The hormones play a very important role in bone growth. The hormones which are essential for proper development and growth of bone include pituitary hormones, that is ADH, ACTH, etc. Okay, thyroid hormones, that is TH or THX, parathyroid hormones and sex hormones. Parathyroid hormones are there because of the calcium, because they provide the high content of calcium and bone requires the calcium. So remember why these hormones are included. Okay, and sex hormones, that progesterone, estrogen, testosterone. This defective secretion can cause number of skeletal defects. So hormonal factors are also essential for a growth of bone. Then genetic factors. A clinical condition, that is chondrodystrophia fetalis. Chondrodystrophia fetalis, that is dwarfism, small height, occurs due to defective autosomal dominant inheritance. There are two, no, autosomal and recessive. This is autosomal and dominant. In this condition, endochondrial ossification fails to occur properly. We have seen now where cartilaginous growth converts into a bony appearance. Cartilage disappear and it leads to bony appearance. This is endochondral ossification. Even in the clavicle video we have discussed this. Mechanical factors. Tensile force helps in bone formation, whereas compressive forms favor bone resorption. Both are equal. In practice, the orthopedic surgeons provide traction for a quick healing of fractures. So these were all the parts. Hence, we have ended the chapter here, skeletal system. In case you have any doubt in the system, or even you have any doubt in the earlier videos we have made, you can ask. Make your this system strong and clear so that it will help you in the further upper limb, lower limb parts. If you will be not clear with all this terminology, where you will face a lot of problem. And if any Gujarati medium or Hindi medium students are there, then please do watch this video and have an habit of understanding the concepts in a fluent English. Try to write down your own notes. Take the notes directly from this so that it will help you to pass in the competitive exam with a good marks. And if you follow this channel, do like the content. In case of any doubt, as I have told, you can ask in the comment section. And one more thing, we are going to start a new chapter. Before that, make sure you also revise the old content of this video. Don't think that if you have seen the video one time it is over. Keep on revising, because these are such things which you might can forget even the exam time or even any time. So keep revising, okay? So thank you. Have a nice day.